A very good afternoon. I'm Harshkansha Gaikwad, rule number 30, and I'll be continuing the topic further of anti-arrhythmic drug from mexiletine. Mexiletine. It is an analog of lignocaine and has similar actions. It is used orally and parenterally in the treatment of ventricular arrhythmias. The common adverse effects are nausea, dizziness, and tremors. Flecainide and propafenone. These are class IC anti-arrhythmic drugs. They block sodium channels in the open state. Class IC drugs have the most potent blocking effect on sodium channels. They markedly depress phase 0 depolarization, slow conduction, and prolong PR interval. Propafenone also blocks beta receptors. Adverse effects. Both the drugs can exacerbate arrhythmias and CCF. Other adverse effects seen with propafenone are metallic taste, constipation, bradycardia, and bronchospasm. Blurring of vision is common with flecainide. Uses. Propafenone and flecainide are primarily used for the treatment of supraventricular arrhythmias. Can also be used in ventricular arrhythmias. Both the drugs are administered orally. Class 2 beta blockers. Propranolol, atenolol, esmolol, metoprolol, etc. are class 2 antiarrhythmic agents. They block the effects of catecholamines on the heart. They depress the phase 4 depolarization, decrease atomicity in SA node and ectopic foci when increased by adrenergic stimulation. Prolong the refractory period and decrease the conduction velocity in AV node, which makes them useful in the treatment of reentrant arrhythmias involving the AV node PSVT to control ventricular rate in atrial flutter and atrial fibrillation. In the high dose, propranolol has codeine-like membrane stabilizing effect. Pharmacokinetics, adverse effects, and contraindications are discussed on the further. Esmolol, it is cardioselective beta-1 blocker with rapid onset and short duration of action. Intravenous esmolol is used for emergency control of ventricular rate in atrial flutter and atrial fibrillation. Intravenous esmolol is also high effective for terminating an attack of PSVD. Side effects are hypotension, dizziness, and bronchospasm in asthmatics. Sotalol. It is a non-selective beta-adrenergic blocker with additional potassium channel blocking, class 3 property, thus prolonging the duration of action potential. It decreases automaticity, slows AV conduction, and prolongs ERP. Sotalol is used to treat life-threatening ventricular tachyarrhythmias and to maintain sinus rhythm in atrial fibrillation. Adverse effects and contraindications are same as propranolol. Sotalol can cause torsades de pointes. Class 3. Drugs that prolong duration of action potential. Amiodarone. It is an iodine-containing compound and structurally related to thyroid hormone. It has a broad spectrum of anti-arrhythmic activity. Amiodarone blocks potassium channels, increases duration of action potential, prolongs refractory period, and suppresses abnormal atomicity. Blocks sodium channels in the inactivated state, decreases conduction mainly in the partially depolarized tissue. Blockade of sodium and potassium channels prolongs refractory period in the cardiac tissue. It also has weak beta-adrenergic blocking and calcium channel blocking actions. It decreases heart rate and AV conduction. Pharmacokinetics. Following oral administration, bioavailability is about 30%. It can be given intravenously for rapid effect. It accumulates in fat, muscle, lung, liver, skin, etc. and has a long half-life that is 1 to 2 months. Amiodarone is metabolized in the liver. Uses. Amiodarone has a broad spectrum of antiarrhythmic actions with low incidence of torsades de points. It is effective in the treatment of atrial and ventricular arrhythmias. It is used to maintain normal sinus rhythm in atrial fibrillation and prevent recurrent ventricular tachycardia. Adverse effects: CNS hypertension due to vasodilation, CHF, and exacerbation of arrhythmias, neurological peripheral neuropathy, respiratory pulmonary fibrosis, GID, nausea and hepatitis, photosensitivity and pigmentation of the skin, eye corneal deposits, thyroid hypothyroidism and hyperthyroidism. Hence, TSH, T3 and T4 levels should be monitored during long-term therapy with amiodarone. Drug interactions: amiodarone and beta blockers, verapamil, additive depressant action on SA and AV node lead to SA block and AV block respectively. Amiodarone inhibits the renal clearance of digoxin, thereby increases serum digoxin levels. It also increases concentration of quinidine and procainamide. Amiodarone potentiates the anticoagulant effect of warfarin. Note: amiodarone is a broad-spectrum antiarrhythmic drugs agent with long half-life, cause multiple effects, may cause wide range of adverse effects, but does not require dose adjustment in patients with hepatic or renal disease. Dofetilide and ibuterolide are pure potassium channel blockers. They are useful in maintaining normal sinus rhythm in atrial fibrillation. Class 4. Calcium channel blockers, verapamil. It blocks both activated and inactivated L-type calcium channels, depresses calcium-mediated depolarization. Verapamil decreases conduction velocity and increases refractory period of AV node, useful in terminating re-entry involving AV node, PSVD, and reducing ventricular rate in atrial flutter and fibrillation. It decreases slope of phase 4 depolarization in the AC node, bradycardia, and in the ectopic foci. Pharmacokinetics, adverse effects during drug actions and uses are discussed further. Diltiazem. All features are similar to verapamil, but it is comparatively less potent than verapamil. Miscellaneous agents. Adenosine, it is a purine nucleoside that is administered as a rapid IV bolus for rapid control of PSVD. The duration of action of adenosine is less than 1 minute because it is rapidly transported into RBC and endothelial cells. Mechanism of action. Intravenous adenosine binds to specific G protein coupled adenosine A1 receptors, which further activates acetylcholine sensitive potassium channels in the atrium, AC, and AV nodes. This causes the potassium efflux, hyperpolarization, and decreased atomicity of AC node, decreased sinus rate, reduced duration of action potential in atria, reduced excitability, increased refractory period, and slowing of conduction in AV node. Adenosine also decreases calcium currents in AV node, depresses AV node. Through its action on AV node, it blocks re-entry of impulses involving AV node and terminates an attack of PSVT. It is the preferred drug for rapid termination of PSVT because it has high efficacy, a short duration of action, adverse effects that last for brief period, minimal negative inotropic action. Adverse effects and disadvantages. This includes asystole, bronchospasm, chest pain, dyspnea, expensive flushing, hypotension, headache. Side effects are transient due to its short duration of action. Drug interactions. Adenosine and methylxanthines antagonize the effects of adenosine by blocking its receptor. Adenosine dipyridamole inhibits uptake of adenosine into cells and potentiates its action. Magnesium. Intravenous magnesium sulfate is useful in Tourette day points even if serum magnesium levels are normal. It can be used in digitalis induced arrhythmias if there is hypomagnesemia. Atropine. It is used in the treatment of bradycardia and AV block due to vagal overactivity, that is acute MI and digitalis toxicity. It has vagolytic action. Isoprenaline, intravenous isoprenaline can be used in second degree or complete heart block following acute MI. Some of the important drugs used in different types of cardiac arrhythmias are, I'm telling you further. So, drugs and cardiac arrhythmias, type of arrhythmia and drug used. Okay. So, paroxysmal supraventricular tachycardia is used for this. Drugs used are adenosine, verapamil, esmolol. For atrial fibrillation, amiodarone, verapamil, propafenone, digoxin. For atrial flutter, esmolol, verapamil, amiodarone, propafenone. For ventricular tachycardia, amiodarone, propranolol. And for ventricular fibrillation, amiodarone and lignocaine. Thank you.